Hi, I'm Bob Lozier, and with me today is Eddie Stevens. Eddie is the Vice President and Chief Information Officer of Infirmary Health. That's based in Mobile, Alabama. Eddie's been in the information technology business for the better part of 35 years. Eddie, can you believe that? You were there almost before IT was invented, really.
It's been a long time, Bob, but back when we used cards and they called it electronic data processing instead of information technology.
It's changed a whole heck of a lot. Also with me today is Frank Lonergan. Frank is Chief Executive Officer of ANCILE Solutions. ANCILE is a software technology company that provides best-in-class business performance software and solutions to over 4,400 companies globally and almost 20 million end users. Organizations use ANCILE software solutions to increase employee productivity and proficiency across their whole enterprise. And Frank, thanks for joining us today. Now, before we get into a whole lot of this, let's talk about ourselves. Eddie, let me start with you. What's your background here?
Bob, I have a diverse background in information technology, but I spent the last 32 years in healthcare. I had some background in banking and in food service industry. But I have been with Infirmary Health System for the last 32 years in various roles within information technology, increasingly important management roles.
True. Frank, what about your background?
Well, Bob, mine is really an education-related background. I actually came out of school. I was a school teacher. I wrote education textbooks, and I kind of carried that into the business world. Getting more involved in working with organizations around learning and performance, and over the last 25 to 30 years have been really actively involved in organizations that are working closely to bring worker productivity improvements into the marketplace, and that's really where ANCILE is positioned in the market.
Well, you and Eddie have a unique relationship, there's no doubt about it, because electronic medical records are the thing that's happening today in American business. And those people who don't jump on board are those who are left behind. Eddie, you might talk a little bit about that, how you came to meet up with ANCILE and Frank here.
Well, Bob, we started along this path for electronic medical record back in 2007. We evaluated different systems. We chose Epic from Madison, Wisconsin. We contracted with them in 2008 and began a phased implementation approach across our system of hospitals and physician clinics. We discovered the ANCILE product through a relationship that we had with another healthcare organization, and it's what brought us to where we are today.
But you knew you had to change. If you didn't change, change was coming to you.
We did. We had to change. We knew that the healthcare world was moving away from a paper record, both from a patient safety and a efficiency standpoint and also from a regulatory standpoint. It was important for us to begin to move healthcare into a more technologically advanced state, and so that's where we started with our EMR. And we started by bringing on our staff, our nurses, our clerical staff, our clinical staff, and we saved the doctors toward the end of this implementation cycle.
You had a lot to do in a short period of time because the mandate was given to you to train 850 doctors, 500 staff members, perhaps more, in the space of what, about 6 months?
We actually, less than that, Bob. We had an opportunity where we had gone live in one of our very small hospitals where we had a very simple and small medical staff. And so the approach there was very simple, I guess is what I should say. Not that the medical staff was simple, but that the approach could be very simple because we could spend a lot of time in a hands-on environment with the small number of doctors that we had to train. But we knew through that process that when we moved into our two larger facilities, that one-on-one time, classroom time was not going to work. It was not going to be efficient. We were not going to be able to bring our physicians to the table and have them spend that much time away from their normal duties. So we were looking for solutions that would allow us to train a large number of physicians in a short period of time at their own pace when they had the opportunity. So we were looking and had tried several systems, but none of them seemed to really click with us and be able to provide what we needed until we came across ANCILE.
Well, and how do you get doctors in on a 24-hour basis individually to be trained no matter how much money you have?
You can't, Bob. You can't. some of them will try to give you short periods of time, but they can't give you 6 or 8 hours of classroom time to be able to train them, to take it away from their patients, to take it away from their practice. I mean, they are independent businessmen, so to take away 8 hours of their time away from their patients, it affects them, financially. It also affects them in the way that they can take care of their patients and the quality of care that they give. So we had to look for an alternative to provide them the training that they needed to be able to use the system effectively and efficiently, but in a way that they could do it at their own time, after dinner at home, after their kids had gone to bed, or when they had a Sunday afternoon of downtime. So we had to look for an opportunity where we could use a multiplicity of venues to train them, where it was a mobile device or a stationary device at their home or office. And we really felt like that ANCILE fit that bill.
Well, and there was no wiggle room for these doctors either. In other words, if they did not cooperate and go ahead with these plans and jump on board, they wouldn't be in your hospitals.
That's exactly right. We had a mandate from our executive committee of the medical staff, which is a committee elected by the medical staff, and they said, you will use the electronic medical record by this date. March the 18th of 2014, you will enter your orders, you will put your documentation in electronically. So we had a very short window to try to get these people trained. We knew that we did not want to address them months and months in advance because, it didn't have the time. It didn't have the time, and if they learned it then, by the time we got to actually using it, they would have forgotten what they needed. So we purposely said we're going to give a 6-week window before go live when we're going to train our physicians. What
was your percentage of physicians who jumped on board at that time?
We had probably 25% of our physicians were very engaged from the beginning. We had some pent-up demand from physicians who wanted to be on the system, and we had kind of held them back and got them encouraged to participate with us. So we had about 25% that jumped in right away. And what we did, we developed a university concept. We branded our version of Epic Life Care. And because our mission is life at Infirmary Health. And so we created an environment that we called Life Care University, or Life Care U.
Sure.
And so we developed courses and we structured them 100 level, 200 level, 300 level, 400 level, just like you'd see in a university setting, where 100 level courses were requirements. Most of the 200 level were requirements, but there were some electives. And then for the most part, 300 level and 400 level were not required, but were if you wanted to know more about how the system operated. But we felt like they had to, at the very least, take the 100 level courses to be able to have a minimum amount of proficiency using the Epic electronic medical record in our environment. And so that's what we got our medical staff leadership to impose upon the medical staff and say, you have to at least complete the 100 level courses in order to continue to practice in our system.
You had about, what, 22 courses that they were to take?
We did. We developed 22 courses initially, and we tried to make those courses no longer than 30 minutes. Most of them were in the 15 or 20 minute range, so that if a doctor had 15 or 20 minutes to dedicate, they could take a course. And using the ANCILE software, we were able to do this guide me, show me, teach me, test me kind of environment where they could go in and let the system show them how to do it themselves, or and take them through the whole progression, or then the system they could take another path that says prompt me on what to do. They could take another path that said just let me try to do it by myself. And then we tested them because we felt like it was important for us to know what level of proficiency that they had. And so we did test them, and we kept results of those tests.
Wow. Frank, had you ever had this kind of testing in such a short period of time? Well, this had to put you under the gun, too.
Yeah, and typically we will come into some situations where we face this. What I think was really unique about this opportunity for us was that, we've been in the business of learning and performance for, numbers of years, well over about 13, 14 years. But as Eddie said, what's really changed is we've been very focused as part of our prior history in the ERP space, helping retail companies, manufacturing companies address their learning and performance. What this presented for us, though, was an opportunity really to address this electronic health record situation, really get into the healthcare space, which I had believed for a while would be a great opportunity for ANCILE to help bring a solution set in. The situation at Infirmary Health presented itself, and we were all in on it because, one, the technology, a couple things that I think kind of relate to or kind of tied to the success, obviously, that the team that Eddie led, was, you know, the technology being ready to actually work against that Epic system, I think was a key. But I think what also was very important in it was the partnership. You know, we knew right from the very beginning that there was this tight timeline, that there was requirements. We understood what the importance was. And I think the team, my team, alongside the Infirmary Health team, really collaborated, partnered to bring this to, the technology worked, but the strategy, the sponsorship, the commitment that Infirmary Health made to it was really the key. And at the end of it, you know, I think the result in what Eddie shared with you, I think was a great story for all of us. Yeah,
and to add to what Frank is saying, Bob, I think that, you know, it was a very simplistic process, really. Didn't require a lot of support from the ANCILE team. They came in, they helped us get the system set up back in November, December timeframe of 2013. We had our scripts built of what we knew we wanted to train. They helped us set up the initial session or two, and then I was able to take my team and go from what the ANCILE team helped us build from lesson 1 and lesson 2 and build out the other 22 lessons in time for us to meet our 6-week window of training.
Yeah, I think that's one of also our partnering keys. We want to enable our customer to really be the owner. Our mission is, let's bring in, let's sit down, strategize what kind of goal you have. Let's make sure that we're aligned to that. We transfer the training in, because our thought on it as well is that Infirmary Health will not only use it for this initial rollout, but we'll have a learning and performance system platform and approach in place so that ongoing they're able to leverage not only what they have created, but potentially bringing new things into the mix that'll be requirements further out.
Well, you know, Frank, you've got, what, 50 of the top 100 Fortune companies out there. I'm wondering, you know, you're going to expand and keep expanding. That's going to take some buy-in from a lot of people who say, oh, this probably is too costly for me. Well, it's not too costly, I don't think. They either have to do it or they don't go along with the rest of the world.
Yeah, I'll let Eddie comment from his side of the house bet on this. But I think, Bob, your point is exactly right. I mean, look, if somebody makes an investment in whatever type of technology, the key is the end user, the person who is actually using that system at the end of the day. How effective are they? So your investment of implementation, the cost of the software, is only your return on investment is only going to come back later in terms of how useful is it, and that speaks to the people. And in the case of Infirmary Health, with the electronic records and the compliance and other regulatory elements that come into play, this is also of value to them to validate that this type of training and learning is being made available.
Well, you mentioned regulatory elements too. Right. I mean, these HIPAA laws, the things that you have to stay up on, or you're going to not only fall behind, but perhaps fall against the law.
Well, and I think to Frank's point about the cost, from our perspective, the cost of training exists, whether you're using ANCILE or whether you're doing it, with a teacher in a classroom. So training is a requirement. And what we saw with ANCILE was initially at least a third, 33% reduction in our training cost. And I anticipate very quickly that we're going to be in the 50% range of reduction in our costs. So when you think about what we've spent on ANCILE versus what it cost us to train, the ROI is there. It's not that expensive a proposition.
Do you almost think that if you had done it a year earlier, you would have been that farther ahead?
I wish I had known about this earlier in the cycle. We've already deployed. We not only trained 850 physicians, but we trained rounding nurses, mid-levels like nurse practitioners and physician assistants in the same manner in which we trained the physicians, because these were not our employees. They were employees from outside the system. And I think that was key.
Yeah, and I wish we had found Eddie a year earlier too. But I think what's also key, and I think this is where Eddie was headed, is that what we find, and I think this is true in Infirmary Health, there was initial need, and we answered the bell. The team at Infirmary did a fantastic job, and obviously Eddie has shared that result. We see those kind of results in ROI in the customers that we work with, and what really builds on that that ROI over time is extended other uses for the application. And so there's an initial point. That's how we get into it. But once people see the result, it opens up the thought processes within the organization as to how else can we leverage this technology to meet other requirements, whether they're in the compliance area, sales information, marketing, all across the organization.
I would think too that the patients have to benefit from this as well, because they are the people who can now access their records that would take a long time to get out in many cases because somebody would have to research it. It's right there online.
Certainly, and we have a patient portal and we engage our patients. It's a big deal now in healthcare to have patient engagement so that we can provide lab results, medication list, after visit summaries, that kind of information to our patients immediately upon discharge through this patient portal. I think to Frank's point also about how we expand this, we're already seeing opportunities to expand this beyond our initial training for the Epic implementation. As you know, in software business, there's always rollouts of upgrades, and so there's changes, and so we've already started working on lessons that says, what's different between this version and this version, so that we can give a real concise learning platform for our physicians to say, okay, in the old version it did this, in the new version it does this. But beyond that, we have this whole plethora of non-employees that interact with the Infirmary Health System that we are now required to train on things like patient safety initiatives, compliance and regulatory changes. And so we are looking at how we've never had this kind of tool before, so we're now excited about what we can do with ANCILE to reach that community, not only our community of employees, but reach that community who are not our employees, because we provide this via the web. We provide this on mobile devices, and so even we're providing it in a very secure environment, but still we have that access to this community of people who are involved in healthcare in our organization, but who are not our employees.
Yeah, and I think that last point is a really important one, Eddie. And from us, from a technology perspective, I think the changes in, there's the content certainly, and that's you're the owner of that. What is the information that you want to transfer? I think though that what's exciting about our application and then other things that go around it in terms of technology is what's been now available to move information to people. And if you think about mobility, you think about smartphones and iPads and what that does to help change the paradigm of how people learn. Right. And so our application enables the formatting, the presentation, if you will, that can be easily transferred onto these mobile devices. And as Eddie pointed out, in their situation, they don't really have control of necessarily all of these individuals to put the time in. It's more of a satellite approach, but that mobility provides the vehicle to make all that happen.
I would think too that people in municipalities, county governments, things like that, those people with railroads, the car manufacturers, whoever, they're going to be stepping into this arena very soon.
Yeah, I mean, it's a large phenomenon. It's more than a trend. It's where the world is moving. And I think where we have really focused our energies is around making sure we stay aligned to these changes that are happening in the marketplace. It's around, and you can even take it back to a demographic. Eddie and I both have 20-somethings or early 30-somethings, and how they learn, their way that they find information. All these people are coming into the workforce, and there's a whole different level of expectation around how an organization is going to help prepare them, how they're going to help keep them informed, how they go about learning information, and that's really the world that we live in.
Well, you have been down this road over the past year, and let me ask both of you this. Is there anything or things you would change about the program if you had it to do over again?
Well, from our perspective,
or did you learn something?
Well,
from
we did. We learned a lot, but getting started earlier would have been a plus. But we were still able to accomplish our goals. we're just excited about this technology that we have, because training in an IT environment has always been a challenge for us. And so we now have a tool that we feel very comfortable with developing and implementing training processes that people can participate in at their own time, in their own way, and we have a measurable outcome that says, hey, they were able to succeed at this. And it also, the one thing that we have learned about this process is that the ANCILE product is so nimble that we were constantly getting feedback from our physicians as we were going through the training, and we were able to make improvements on the fly, basically, to the training materials based on the feedback that we were getting from the physicians.
And ANCILE was open to that. They were saying go with it.
And they were open to it, and their product and the tools that were available to us were geared in such a way to be able to do that.
Yeah, and I think, if I could go back, I think I mentioned this earlier, would have been, wish we could have found each other earlier. Because I think, the exciting part about, certainly the healthcare industry and the change is that I've believed that for a while that, we could make a difference in this. I think our relationship with Infirmary Health has been beneficial, mutually beneficial. I mean, Eddie's been very gracious in talking about, what our applications have been able to do. We, in turn, have learned a tremendous amount about the requirements, the structure of those, the compliance elements that really tie to running a healthcare system organization, the nature of the audience that we're, in place to address or working toward bringing this information to. These are very valuable pieces that we bring back, and then help us understand how else can we either fine-tune the application in some ways to address that, or think about other applications that we could bring to the market that would obviously be of help to Eddie and others in that healthcare
Isn't
arena.
it funny how we struggle against technology in many ways? Because the three of us on this panel here, we were not, we were raised perhaps with a rotary phone, maybe even a black and white TV, and then we saw it start to move, and then it moved at a faster pace, and faster still, and we're always afraid of change, I think, in the workplace.
Yeah, this is the world I live in, which is that, that's one of our biggest challenges as a technology company. It's both a challenge and an opportunity. The challenge is that the technologies will continue to race ahead. I think one of the challenges is trying to understand how the marketplace moves to take advantage of those. So in other words, we don't want to be so far on the front end that nobody can use any of this stuff. We have to work together with our customer base, and you mentioned this earlier, to really understand what are they capable of in terms of consuming it. But we see changes in terms of organizations wanting applications on premise versus or now moving more to a cloud deployment. So there's changes there. We talked about the actual applications and devices, iPads. This morning I just turned the news on, and there's a doctor app now. You can put that on your smartphone. You can call your doctor online.
Well, that's what I wondered.
And so my view on that is, and you're right, you're absolutely right. I'm millenniums old, and how I learned is completely different than those 20-somethings I mentioned. But I think the thing is helping people. For me, it's helping people see how we can help them jump the river. Get the technology comfortable where they know that they can really be effective with it, and that's really the business that we're in.
Well, you mentioned physicians too. Yeah. Now they're a group overall, I would think, and I don't want to speak on behalf of them, but they certainly have their own ideas of what works, what doesn't, and sometimes getting the buy-in is a little bit harder. Yeah. What has been the reaction from these physicians? How do they feel about it? And what percentage are you getting to truly support your program?
Well, it is, working with physicians can be a challenge. They are very independent thinkers, and they're trained to be that way, and we want them to be that way. And they get ingrained in a process because that process works for them. So when we interject things like technology, sometimes it is we do meet with resistance to that for that change, and they are a little reluctant to adapt to the technology. But I've told this story many times. One of the good things about the ANCILE product, and as we've mentioned mobility, I've had physicians sit across my desk and say, you know, I don't use technology. I'm not very adaptable to technology. And I look across and there's an iPhone on their belt and there's a iPad in their lab coat pocket. Yeah. And so I said, well, what if I could deliver everything to your iPad and your iPhone? You know, would that make it easier for you? Well, I use that every day. I said, well, that's technology. Mm-hmm. And so having the ability to port these things to that mobility platform has really helped us and helped the physicians adapt to the change.
Well, you have got, what, a 700-bed hospital, a 150-bed hospital.
We do.
You've got acute care, you've got surgical, you've got diagnostic, you've got about everything on the planet. How did these people, and let me just ask real quick, all the employees, now that may be somebody who's working on the boiler over here and somebody who's changing the bed sheets, how did they react to this? Was there any difference from what you expected?
Not really. Our employees were accustomed to technology and accustomed to change, even from environmental services, as you mentioned, to dietary, to nurses on the floor. And we've always used technology in our system. But this was the first real foray into the medical staff themselves. They had looked at things on the computer before, but not really interacted with the computer in terms of entering their own orders and doing their documentation electronically. They were used to writing all that down on a piece of paper and having somebody else enter it into the computer for them. So it was a change, and many of them adapted very quickly. You know, as far as the ANCILE training was concerned, we had very quickly we had over a 70% compliance rate of completing all of the modules, all 22 of the modules. Wow. So, you know, everyone on the medical staff had to complete at least the 100 levels, but we had over 70% of our physicians complete all 22, even though they were not required. So I think once they got in and saw that this was not that difficult to do, and they could learn privately, so that they were not embarrassed if they, you know, stumbled with something along the way. I think that was a big thing for them too. So I think having the ANCILE product and the ability for them to use it in the different venues really made a difference for them adapting to the change. As you mentioned, you know, we at Infirmary Health, we have 5 hospitals on 3 campuses, you know, over 1,000 beds spread over 2 counties. We have 30 medical practices. We have 3 standalone diagnostic surgery centers. So we are spread out over a multiple county area.
And for those people who don't know, it's Mobile, Alabama.
It's Mobile, Alabama.
Baldwin
We're in
County.
Northern Central Gulf Coast. About as far as you can go without running into water. So.
Huge area, huge area. So there is real value that you found by ANCILE coming on board when they did. I mean, you saw it, and you saw it progress on a weekly basis.
Yeah, there's no question, Bob. We would not have been able to meet our objectives of our target date of March 18 for go live and training all our physicians and having them prepared. Certainly it didn't go off without some problems, but the problems that we had were so minimal compared to what we could have had. The fact that the physicians, if they had a question 4 days in, you know, we had support staff to answer those questions, but they could go back to the courses in ANCILE and review that information. If the way we had structured the courses, if they just had a question about how to enter an order, they could go just to that course and get some refresher in about 15 minutes. And we did a lot of things with ANCILE besides just have the you know, how-to with watching it, you know, and with the voiceover. We did things like videos, we did things like PowerPoints, we did hints and tip sheets. We provided a lot of educational material through the ANCILE platform for our physicians.
Wow.
And I think
Go ahead,
I was just going to say, I think the uPerform application, which is what Eddie is referring to, is that the flexibility. That's one of the key features of the application. So I kind of think of it as like a Swiss Army knife. There's just all kinds of different elements in there. Whether you're learning e-learning, you want to do voiceover, you want to do the help me, show me approach. So it's simulations. That's again, it gives flexibility to the organization based upon the requirements that they have. to deliver that learning. So, you know, it's really the philosophy that we have built into the uPerform application itself.
You know, we tend to talk in terms of the fact this went out in March of 2014 and it's done very, very well. But you're still benefiting from what has happened each and every week as it continues.
Yeah, we had an opportunity where in the old environment, unit secretaries or unit clerks, whatever you want to refer to them as, were that clerical administrative support person at the nursing unit that was the go-to person for the physicians. And they were the people who typically took the handwritten notes and helped to transcribe them into the computer. So there was some great concern about, from their perspective, about how is my role changing and what are we going to be able to do. So we took an opportunity to train them on some of the aspects of what the physician does so that they could still provide in that a support role where they could show the physician, well, this is where you find that in the chart electronically. This is where you go. And we use the ANCILE product to teach them kind of an overview of what the physicians were actually doing. So they would be able to be that frontline support. And that's just one of the many ways that we think we'll be able to use this training platform as we go forward.
Well, now, how's this impacted the bottom line? That's probably a good question. Eddie, start in.
Well, as I said before, you know, we feel like in this particular instance with this one particular project that we had of rolling out CPOE and physician documentation, we cut at the very least a third of our training cost out by using this product. I can see easily how we are probably going to be at 50% savings if we're not already there. And I believe the opportunity is there, as Frank said, as we expand and as we become better with the technology, that we're going to even drive the more training cost out of the system. We're looking at opportunities now where things have been being done by our nursing education department in different ways that we're going to be able to dovetail and maybe eliminate something that they're doing today and fold that in with the ANCILE training product that we have, the uPerform, as Frank mentioned. And I think that we have a tendency at Infirmary Health to push the envelope. And so my staff is already looking for opportunities of how we can utilize and get the most out of the ANCILE uPerform product. And based on their history, I think they'll come up with all kinds of opportunities and challenges that we'll be presenting to Frank and his team of how we might be able to better use the product.
Right. And I think, you know, from my perspective, Bob, Eddie's really highlighted, it's not atypical. I mean, what we see is there are obviously some initial savings on the production time, costs of moving people, transportation of moving people to classrooms, all of that brick and mortar type costs go away essentially. But then again, as Eddie rightly points out, it's an incremental return. And I think what I've seen already with Infirmary Health is the sponsorship and adoption of the uPerform application. And already, as Eddie's already shared with you, the thinking within the organization of how else can they leverage it, and then that just compounds that return.
So uPerform is just in the beginning stages, really.
It really is, and we have just recently added some tracking modules that we did not have. We had tried to do some of that on our own, but we have just recently contracted with ANCILE to add those modules, and they just we're on site installing those. And you know, as we grow this, I'm sure we will continue to grow our relationship with ANCILE.
Let's go for a couple of final comments here. Anything that we haven't touched on that you'd like to get into that perhaps will help somebody else who's watching this and says, is this for me? Could I do it? Is it affordable? Will it increase my bottom line?
Yeah, from my perspective, Bob, I kind of shared the story that we have been very immersed in that ERP space and manufacturing, but always believed and knew that we could expand our horizons, because the common denominator for us is really around worker productivity. The systems, the technology, as Eddie has shared with you, we're very flexible in our technology and how it'll work and what systems it'll work against. So, you know, when it comes to people thinking about how do we enable our workforce to increase effectiveness, the ROI, our competitive advantage, we really have a position that can help bring that to the table. And I think, you know, our experience with Infirmary Health, and I mentioned, and you mentioned up front, you know, the number of companies that we work with, I still believe, despite the large number, which is really, we're very blessed to have that kind of a customer base. I believe our value, though, is how we do partner with our customers to really help us understand their requirement, but then also, you know, how do we then kind of move in and bring in our technology, help them understand how to use it, make sure that the handoff is in the right way, and then ongoing from there. But we're always continually attached, I think, is really the key.
I imagine there's some real good advice here to be given to IT asset managers, other healthcare organizations about getting on board. What would you tell them, Eddie?
Well, I've had many of my peers already reach out to me about this. IT training, as we mentioned already, has always been a challenge. It's always been an expensive proposition. It's always been something that we all as an industry, particularly in healthcare, have struggled with. And so, based on the success that we have had, many of my peers are already reaching out to me and saying, you know, tell me more. How did you do this? And tell me more about the product. But I think the key for us has been, you know, there's been computer-based training around for many, many years, but I have never seen anything that had the flexibility, the nimbleness that we have experienced with the ANCILE uPerform platform. And I think that's key. And I think that's what my peers are wanting to hear, is that it is flexible, it is nimble, it does allow us to respond, but it also allows us to put our own stamp on the education. Healthcare, you know, every hospital thinks it's unique. And to some extent it is, because healthcare is unique, it's individualized. So every hospital has its own unique set of problems, even though we have a lot of global problems that we share. And I think this product allows healthcare, the healthcare industry, to be able to put its own stamp on training. Just as we branded our training, and just as we, you know, the way we do things, because every EMR system is not implemented the same way. We implemented Epic differently than it was implemented at other hospitals across the country. So we needed something that allowed us to train our staff on how our implementation of Epic looked and worked. And this gave us that flexibility and that capability.
Yeah, and I can't articulate it any better than that. I think the most powerful message, and one that I'm, you know, very happy to hear, is really the benefit statement around what, you know, we did, or what the application did, uPerform did, to help Infirmary Health. Because this is really the testimonial that, and I want to meet all the other peers that you have, Eddie, along the way, but I think it's a validation for us that we can make a difference. This is very important. I mean, if you think about all of the activity that is going around from the government perspective around healthcare, and how all that's changing for all of us, you know, how we're going to interact with the medical professions, this is the time, and I believe that ANCILE can be an important part of that change that's taking place.
I think you're right. I think the number of emails and phone calls to each of you gentlemen is going to go up in the next few days. No doubt about it. Thanks for being our guest today.
Thank you, Bob.
Thank you, Bob.
A real pleasure. Frank Lonergan, he is CEO of ANCILE, and of course he's here from Maryland today, and then from over in Mobile, Alabama. Good friend of mine too, Eddie Stevens, CIO as well as Vice President of Infirmary Health. They've been our guests today, and thank you for joining us.